left atrial appendage occlusion, as we all call it, the LAAO procedure, and the transcatheter edge-to-edge mitral valve repair, that is the TEER, are two commonly routinely performed cardiac procedures. Now, they are usually performed at various centers and are typically performed under the guidance of fluoroscopy and also the transesophageal echocardiography. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the impact of radiation exposure to doctors and healthcare professionals who are performing cardiac procedures. In a new cross-sectional study of over 60 structural heart procedures, interventional echocardiographers, they experienced higher head-level radiation doses than the interventional cardiologists and the sonographers. Now, the study findings that I'm talking about are published in the JAMA Network Open. Now, despite previous work demonstrating high radiation exposure for interventional cardiologists who are performing the percutaneous coronary and the structural heart interventions, similar data for the interventional echocardiographers are still lacking. So, in this study, the radiation doses were collected from the interventional echocardiographers, the interventional cardiologists, and the sonographers at a quaternary care center during 30 sequential LAAO procedures and 30 sequential transcatheter edge-to-edge mitral valve repair procedures. So a total of 60 procedures were performed in 60 patients with a high cardiovascular risk factor burden. The findings of the study, it showed that the median radiation dose per case was higher for the interventional echocardiographers than for the interventional cardiologists compared with the interventional echocardiographers. The sonographers exhibited low median radiation doses during both the LAAO procedure as well as the transcatheter edge-to-edge mitral valve repair. The researchers therefore concluded that the interventional echocardiographers were exposed to a higher radiation dose than their counterparts during both these procedures, whereas the sonographers, they demonstrated comparatively lower radiation doses. So higher the radiation doses did indicate a previously underappreciated occupational risk faced by the interventional echocardiographers, which eventually has implications for the rapidly expanding structural heart team. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.